In the U.S., drug overdose is the number one cause of death for people under the age of 50. Opioids like morphine, oxycodone, heroin, and fentanyl are the most common drugs that cause death from overdose. Naloxone, a drug many know by its trade name Narcan, is very effective at reversing the effects of opioids. Knowing how to recognize an opioid overdose and how to respond quickly with naloxone can save a life. This training will go through the steps you should take to help someone you think may have overdosed on an opioid. When you approach a person you think may have overdosed on an opioid or other substance, the first thing you should try to do is wake them. Try talking loudly and shaking their shoulder. Call for help and get others involved. If your attempts to wake the person in the usual ways don't work, try doing a sternal rub in which you make your hand into a fist and then rub firmly in the middle of their chest with your knuckles. If the person does not wake up, look, listen, and feel for breathing. If they don't breathe at least once every 6 seconds, they are at risk of dying. You can also look in their eyes. People who overdose on opioids typically have very small pupils, similar to if a bright light were shined in their eyes. No matter how the eyes appear, if the person is unconscious, call 911 immediately. It is now time to give naloxone. Find your naloxone and open the packaging. Inside you will find a naloxone nasal spray device. Naloxone is absorbed rapidly through the nose into the blood, so it is fast enough to save a life. Tilt the person's head back and then insert the device into the person's nose on either side. You will then press down firmly on the plunger. If you see the person starting to respond to the naloxone by breathing deeper or faster, place the patient in a recovery position by laying them on their side with their hand behind their head and their knees bent. Naloxone kits usually come with 2 nasal spray devices, so if the person does not start waking up within 2 to 3 minutes, you can give a second spray of naloxone on the other side of the nose with the second device. If the person wakes up, talk to them and support them until the ambulance arrives. Naloxone does wear off after a while, so the person is always safer going to the hospital than leaving on their own from the scene. If at any time you find the person stops breathing completely or does not have a pulse, you should start pushing on the chest hard and fast, about 100 times per minute, until the paramedics arrive. Remember, the law protects bystanders who try to save someone's life in good faith, so do your best, even if you don't know everything you should do.